Welcome to the Art of Listening to Your Body podcast. My name is Dr. Jinong and I'm your host. I'm a cathartic release therapist, professionally trained as an osteopath, psychosomatic therapist, Western acupuncturist, and herbalist. I'm fascinated by the mind-body connection and how your physical body is a manifestation of your emotional state. I help people get unstuck from their chronic pain, whether it be physical or emotional, and live the life they truly desire, grounded in values and driven by purpose. My aim is to create awareness to the underlying emotions behind pain, injury, and disease in the body, as well as behavioural dysfunctions and mental imbalances that present. I do this using a unique blend of Eastern and Western philosophies and a good dose of intuition. Join me to learn more about the story of your body, what different issues may indicate, how to release emotions so that you can prevent problems, as well as inspiring pain story interviews. If you're listening to this live on July the 18th at 11 a.m. New Zealand time, I will be running a free live release masterclass for 2 hours. This is where I cover in depth the actual process that I take my clients through when I am facilitating a release on the physical, physiological, and the emotional level. And I'll also share with you the Eastern philosophies that I tie into my work. So I will cover the chakras, the basics of chakras, and how you can use this to understand what emotions might be buried in your body and causing the physical and mental issues that you have going on. And also how I use Ayurvedic doshas when it comes to this work so that you can understand how you're going to respond, and also how you can use these to connect back to your true nature to really understand yourself on a deeper level and not be so dictated to by society and marketing and advertising out there. So this will go for 2 hours. I will also use this opportunity to share a little bit about my 6-week release course, which is where you can take all of this work a level deeper. This will be the second time I'm running it. The first time was incredible. The energy was palpable. The shifts that people were getting was absolutely amazing during the 6 weeks, but also beyond the 6 weeks. This work continues to evolve. It continues to drop in. You'll hear something different every time if you've joined me on previous masterclasses or even on the course. I still love hearing from people the shifts and the changes that they are getting in their life. I share so much on my masterclasses. These are live. You'll hear new stories, and I hope you can join me. It is on July the 18th at 11 a.m. New Zealand time. For those of you in the States, Canada, and UK, this is going to be Saturday for you. So make sure you join and register. It is at theartoflisteningtoyourbody.com/release. I will pop it in the podcast notes. When you register, you'll get all the reminders, your special Zoom link, and you'll also get all of the time conversions as well. If you do show up live as well, we will be sharing something special with you in the chat that you can use towards the 6-week course. So make sure you register, and we will also be sending out a replay. After I interviewed my guest, Heidi, I decided that she was going to be the perfect live guest for my upcoming 6-week release course. So she'll be joining us midway and teaching us how to pandiculate. You'll find out more what that means in this interview. Today I'm joined by the super enthusiastic and passionate Heidi Hadley. She has so much energy for the world of somatic therapy and movement. She started off her professional life as a medical technical officer in neurophysiology at a hospital in the UK. It was here that she was exposed to many clients with different neurological conditions, including those with severe epilepsy who were experiencing side effects from their pharmaceutical drugs. And they mentioned to her that they were also seeking out complementary and natural therapy to help with these side effects. And this led her down the pathway of natural therapies. And she is trained in many things. She started off in massage therapy, myofascial work. She is also a baby and infant massage educator. And then she got into the world of somatic movement and therapy. She's based in Adelaide and runs her own wellbeing clinic, and she has also moved into the online space with her program called Total Somatics. She's got so much to share with you today. She's very entertaining to listen to. There's a few little exercises that you can tune into, and I've got some details on how you can find Heidi online in the podcast notes. Enjoy. Welcome to the podcast, Heidi. I am very interested in your field of work and what you have to share with us today. Can you start by telling us who you are and what you do, a little bit about your journey?
Yeah, sure. Thank you. So my name's Heidi Hadley. I'm originally from the UK. In 2010, my husband and I emigrated to Adelaide, South Australia. So way back, I originally trained and qualified in the field of neurophysiology. So I worked within the NHS, or the National Health Service in the UK. So it was a really cool job. I worked in diagnostics, so you get lots of people with lots of neurological issues. And thankfully, I worked in a huge hospital in Birmingham, and it's called the University Hospital. So it's like a big neuro centre. So I was fortunate to have so much different insight and experience into things that many people in the smaller hospitals wouldn't have got. So it was great to have that basis, really, to start my journey in this whole neuro world that I'm in now.
What sort of conditions did you work with?
Oh, lots. So, I'd be running outpatient clinics. So you'd get people with like epilepsy and uncontrolled epilepsy. So, they would have tried lots of medication and it wouldn't have worked. So then what you would also get is people coming in to find out where that epileptic discharge was from. They would go through lots of counselling and support with neuropsychologists in conjunction with that. And then what would happen is, long-term, if the epilepsy was just constant, they were constantly having seizures and medication wouldn't treat it, the last resort would be they'd be in theatre. And then I'd go in and then be working with a consultant neurophysiologist and a neurosurgeon. And what would happen is they'd open that bit of the skull, and then there'd be disposable electrodes that you put on the brain to basically clarify there and then that that's where the epileptic discharges came from. And then the surgeon would remove like a nano-sized bit of the brain tissue in order to stop that seizure. Sometimes there were other things that could be of benefit, but that patient was aware of that when they went into the procedure. So that, looking at the brain and seeing this sort of bluey grey matter and thinking that thing controls everything that we do in our life, and even the whole thought of consciousness and subconsciousness, and you look at all that and you think, this is incredible. So yeah, you'd see people like that. And then also my passion was sleep disorders. So I do a lot with sleep disorders as well. And then I'd hold clinics in other places for like nerve conduction studies. So there was a huge variety. People with MS or being diagnosed with MS, they would come in. So it was a huge area and I absolutely loved it. But the thing that I found was that you'd see the patient in the diagnostic side. I was able to interpret the test results because that's part of what you did in your training. But then it stopped there. And that was where there was this yearning, thinking, there were some cases that you felt really sad for young people being diagnosed with quite debilitating diseases, thinking, oh, I wish I could do something to help them. Or, years later, you think, I wonder how that person is, and all that sort of thing. And that's really talking to some of my patients when I was working in neurophysiology as well. They started telling me about complementary therapy and therapists to support them. And that's what really got my interest. And so while I was working full time in neurophysiology, I started going to night school, learning all about these different therapies. And at the time that was right for me, I then left the NHS and started building my wellness business. So that's like 20 years ago now that I've been running my wellness business back in the UK. Then we sold it and then we moved to Australia. And now I have a wellbeing centre here in Adelaide, South Australia. And then I have an online membership for people in over 10 countries around the world for somatics. So it's been great because I'm still geeking out on the neuro, but instead of it being like just diagnostics, which it was originally, now I feel like I'm there supporting them and helping educate and upskill them basically in the area of their health and well-being. And it feels much more rewarding for that reason.
Yeah, wow. So would you say that when you were in the NHS and in the very medical arena, were you feeling a little bit of a disconnect and wanting to bridge that gap?
Yeah, I mean, I loved working with my colleagues. I loved the patient. And that was the thing. I loved that patient contact and that rapport. And, just the whole being immersed in all the neuroscience. And if we go back years ago, I mean, the neuroscience back then to what we know now, it's incredible. The leaps, it's mushroomed in the research and the findings. So being the hub in this neuro center, this neuroscience center was really exciting. But you're right. There was that fact that there was a bit of a disconnect, that it just felt, well, basically it was very clinical. You'd be there doing these tests on people. And I think that was the yearning to think, I feel like I just want to support them. And you can't save the world, but you feel like you want to just help these people where you can. And you often, I wonder how some of them really stick in my mind. And I think, I wonder what they're doing like 25 years later,
Oh, yeah. I love it when people actually get in touch with you. So if there is anyone that remembers Heidi back in the day, like reach out to her, because sometimes you do wonder what happened to that person, and they've had some amazing stuff happen in their life. They've had some challenging things, but yeah, it's nice to close the loop sometimes.
It is. Yeah.
So why were these people seeking out the complementary therapies? What were their stories?
But some of them were having like side effects to medication. And so they were saying to me that what they were doing, it was helping to alleviate some of their anxiety or sleep issues, or some of them as well were saying about their digestive function. So, some of them were doing things like reflexology. And I thought, what's reflexology? And then there were other people that were using aromatherapy oils. And I was like, my mom grew up burning essential oils. So we always grew up with the oils, but apart from that, I didn't really have a deeper understanding. I just knew that my mom would, if we had head cold, she'd put tea tree and eucalyptus, and it was all very nice, but I didn't really know the proper chemistry behind it all and how it interacts with your body. So that was really what sparked my interest from there. And really just broadening my horizons and questioning things, because sometimes in that conventional world, it's, you can't put things in test tubes. And as the years go on, and we've, there's like Norman Deutsch, and I've been to lots of different seminars with him, or Bessel van der Kolk, different people like that talk about, neuroscience and things. One thing they'll always say is that you can't pigeonhole people. Everybody's brain is different. Everybody's system is different. Everybody's personal history is different. You meet that person and you treat and work with them there and then on the spot, and, through a course of treatments. And so that's really where my awareness started to expand, because of that whole training and background, and it continues. You know what it's like. It continues all the time. If somebody thinks they know it all, that's the time to be very worried about what they're saying, because yes, life and science and education, we're constantly changing and evolving. So it's really interesting and very important to stay up to date.
Oh yeah, absolutely. I'm just thinking of some of the practitioners that I work with, and sometimes wanting to be there now. And that's why it's really great for you to share your story as a practitioner and where you were and where you are now, but also you don't know where you're going to be in another 20 years. And it's really exciting. And I love, I used to get nervous back in my very early days of practice seeing a client because I didn't know what they were coming in for. But now it's so exciting that you're just going into the complete unknown, and you just have to be fully present in the moment and really listen to what that person's story is.
And I think you're absolutely spot on there. It's about being fully present, because I was only having this conversation with a client yesterday, and she was talking about a situation elsewhere. And she was just saying the person's been in the job too long. It's like they've disconnected. They're kind of they're relying on a reputation they've had for years. And then she was recommended to go and see a different health practitioner. And she went to see this person, and they were just so much more modern and more dynamic. And then they were showing them all these possible ways that they can move forward with their well-being. And I think that's exactly what it is that we always need to be present. We always need to be there for the client or the patient in order to basically get the best outcomes, really.
Yeah, I know sometimes when people say, I work with the best and the top people out there, I'm like, okay, well, are you getting results? Do you feel like you are making shifts? Because sometimes the person that's fresh out of uni actually remembers the condition and they can diagnose you quicker. Not that we're always after a diagnosis, but yeah, it does have that different perspective. And I think a lot of the conventional medical community are becoming more open in their early days of study to this other side that we're very open to.
And I think there's a level of humility, isn't there? When you're first out of your training or in your early days, there's this humility, because you want to keep learning and you've got to build on your skills and your reputation and things like that. And then what can happen is, we hear people as they get older, they're wise and they've got this wisdom, but sometimes with that can become quite rigid in their thoughts and their outlooks. And sometimes there's that, they might not be so teachable. They might, because of, belief systems and that sort of thing, is that if they're very stuck in a certain way, it can have this ripple effect. So it's right that sometimes the younger ones in their field are more malleable. They're more approachable. They'll go to more courses and listen to all the new techniques that are happening, because they're willing to learn and they're willing to adapt and pivot. That's the difference, isn't it? So there's pros and cons for both ends of the spectrum, but I think there's a bit of humility involved as well.
Yeah. So you've got a couple of practices, you've had practices, moved on from them, and you've evolved as a practitioner. So thinking of the practitioners and healers, therapists, practitioners, coaches out there, can you just share a little bit about your journey entering natural medicine, a few of the things that you studied to get you to where you're at right now?
Yeah, sure. So in the early days, I was learning all like sports and remedial massage and aromatherapy and Indian head massage and acupressure and basically I've done like dry needling, myofascial cupping and myofascial release, all of the different body systems and work. And bringing great results to patients or clients over the time. And then we emigrated to Australia, and then I continued doing all my studies. But it was really interesting because it's like, you get these chance meetings, and there were two people. One was a professional cyclist and another was a person that was mentoring that professional cyclist. And they both told me about something called somatics. Now, I came from a dance background growing up, so it was all about stretching and all sorts of things. And I qualified in stretch therapy along the way with many, many modalities that I've done over the years. And so, again, belief system-wise, I thought stretching was the way forward to release tight muscles. And then I had a few injuries of back and shoulder issues because doing lots of sport. And, the work that we do, the physical therapy work, it's pretty full on your body, And so this professional cyclist that was visiting Australia at the time, but lived most of the time overseas, and his mentor told me about somatics. He showed me one specific movement. And when he did that movement, it actually freed up my shoulders, freed up my back. And I had this moment thinking, well, it was hardly anything. I didn't feel like I was breaking out into a sweat. It didn't feel like effort. And he said to me, because he was shown that when you actually reset your mind and body connection and you work with your software or your brain, that's when you work with resetting the sensors that are in your muscles that are being told to stay tight by your brain, when you work intelligently with your body, you don't have to work hard and you can release with doing somatic movement. So that, again, as you can imagine, I thought, So I went on to then spend like over a 6-year period doing all my clinical studies and then somatic movement teaching. So that's what I've done to bring me to today. And it's been brilliant because I still see people for like the physical therapy side of things, but I see a lot of people now for somatics, and a lot that we're seeing me for the hands-on physical therapy work have migrated across to somatics, because although they get a good treatment with me, what happens is that people come back with chronic issues, the same problems over and over again. And when you actually address the deeper meaning of what's going on, there's a lot of subconscious movements, postures, behaviors, mindset actions, which then basically pattern tension throughout your body. Unless we change that, it's like a broken record that's going on subconsciously there in the background. And when people then get pain, then they go, how can you help me? And so what we have to do is peel those layers away. And that's why somatic, with me, in total somatics, I teach movement, mindset, and mindfulness. Because when I learned my training, it was very much based on just somatic movement. But because I've done additional studies in neuropsychology and trauma therapy and different things like that, what I noticed is that you can do the movement, you can do that and go through the motions, as it were. But unless you address the emotional aspect, the mental, the mindset, the belief systems, the habits that we have every day, you're just going to keep going back to the old patterns of posture and movement and behavior. So basically, that's why I moved into that whole area, because I just found that it was creating eureka moments for clients and also for me. And then they go, wow, is that why I get that recurring pain like this? And I've got, when I talk about this, I always get goosebumps, and I've got goosebumps again, because basically what happens is their eyes fill up and they go, this has changed my life. And, when they come in for their first clinical somatic session and they're telling me everywhere they've been through the system, they've been everywhere. I usually see people as the last resort, because they've been everywhere. And then when I start explaining how their brain and their body, we in somatics, we say it's your entire soma. So it's from the Greek being the whole person. So it's your emotional, your mental, your physical, your energetic health. When all that is encompassed together, you can't separate things. Do you know what I mean? You can't really do that. And so when they start telling me their history, their pain, everything that's going on, and as they sit there, I'm watching their entire soma recreate that pain. I see it in front of me. So then I just start, and I've got a few visual aids, and I will teach them there and then what their brain is listening to all the time, how their body is keeping like a record card of everything that's happening in their life. And then how we can start to unpack that, get to the subconscious patterns, notice what they are, and become more conscious or mindful of how they move and breathe and, sit and work at their station, workstation during the day. And it's at that point that, again, the tears flow. There's a lot of tears often because they've been everywhere. And they're tears, and they go, and somebody only recently said to me, wow, I thought there was something wrong with me because nobody was getting me. She said, but what you're explaining to me makes perfect sense. And I think that's part of what I find in total somatics. It's about the education process, because what happens is if you don't teach somebody what's going on internally, if you don't teach them how to read those subtle signs of what's going on in their body, what you basically find is that they just live subconsciously. They live on autopilot all of the time. And you get them in this authoritarian mindset where they've lost an identity of themselves, and they're being given labels and told what to do and how to think and how to feel from well-meaning health professionals. But these people are just layering on so much stuff that they take that in, and it starts to become a huge burden, and it's very overwhelming. And so part of that is getting people to trust themselves and trust the process and know that they've got this beautiful soma, and their beautiful soma has these processes like neuroplasticity, which means that your brain is constantly adapting and shifting and changing, and bioplasticity, which is what pain scientists talk about now. And that's where your body is constantly changing and shifting too. So because of that, if you teach them that we're constantly evolving and changing, they realize that they're not set in stone, as it were. And that, again, as you can imagine, that's why I get so excited about this work, because it just changes people's lives.
Yes. Oh, I love it. All right. So Can you explain it? And perhaps this is best done using a couple of client examples of how you integrate the movement, the mind, the belief systems, the emotional aspect, because I think a lot of people, they kind of get it or they want to get it, but they don't. And even practitioners out there, or just, people who are listening to this who are at the end of their tether, like, how do you bring all of that together?
Yeah. So there's one case I'm going to give you an example to. And if anyone wants to see the before and after photos, and there's about 3 or 4 before or after photos, there's a free ebook if they want to look at my website, totalsomatics.com. If they look, there's a free ebook. So this person I'm going to mention, first of all, his picture is in that free ebook. So if they don't get it, just picture this as I describe this. But if you can imagine this young man, his early 20s, this was about 4 years ago now, I reckon 4 or 5 years ago. So he's a lovely tall lad, came in to see me. But if you can picture, his shoulders are incredibly rounded. His rib cage is depressed. His chin juts forward. His tailbone's tucked up and under. His knees are knocking together. He's basically walking incredibly rigid. So it's like the back of his body is just got no movement. The front has, and his sides have got nothing. So he's walking around very robotic. Now, when he came to see me, he said that he was given my details by somebody, and he said he came to see me because the last person he went to see, a health professional, after they worked on him, he had to lie in the bath for 2 hours with lots of painkillers. He was in tears, in agony. So he said he was terrified for anyone else to touch his body. So I thought, well, this is great because I don't have to touch his body. There is hands-on clinical somatics that I can work with him. But if we're talking on a trust aspect, this is where I want him to embody him, his practice and things. So I can teach him these movements and we'll break it down, but I don't have to touch him, which again can be a bit of a block emotionally and mentally. So he was in pain. He was on all these painkillers. A young lad, he'd had a lot of anxiety over the years, which had really, and he's very tall. So all this sort of stuff made him feel he questioned his self-worth, and he would always not join physical education classes at school. There was always an excuse why he didn't do it. So he had a real anxiety about his movement and coordination. So he said he would have loved to have done sport, but he just felt all clumsy and in pain. And he was always in pain because it was so tight. And if you do look at the picture, you can see why he would have been so tight. So basically, we had a 6-week program, and every day he would do the practices that I would teach him. We went through mindset and mindfulness practices. So we started with using his hands, because if you look at your brain map has a third of your brain map is rich in sensory nerves. So I always say to people, they're like a second pair of eyes. So to embody and sense and feel his soma, or the movement in his body, first of all, the very basic practice, I get him putting his hands on his chest or on his belly or on his ribs and starting to bring movement back into these areas, so that basically he can start to notice that these areas should have movement, whereas they've been hunkered down through stress and posture and habits and all sorts of stuff. But as the time went on, I taught him about the principles of movement and how when we move, one side of your body should contract and the other side should lengthen. I taught him about diagonal movement and how you've got things such as fascia, and you've got these slings, and they kind of go from opposite hip to shoulder, and they go all in different directions. But when you get people creating this imagery, and then they put that imagery and they can feel it and sense it and embody it in themselves, then they realize that they do have these spirals. And then you start getting them trying to explore them in their daily practice, in their daily activities. But the most powerful thing is that in clinical somatics and in somatic movement, I teach them a 3-step process called pandiculation. Have you ever heard of pandiculation?
No.
It's pretty funky. So basically, with pandiculation, it's what cats and dogs do. So people see a cat and dog and they think they stretch. And in actual fact, what you're catching with a cat or a dog is when you see them, when you see them with their little bum up in the air and their arms, or their front legs, should I say, not their arms, their front legs are reaching forward. People go, oh, look, they're stretching. But they've missed the first and they've missed the third stage of that practice. So basically, pandiculation is a reset, a sensory motor reset. And it's basically where your sensory motor part of your brain is resetting the sensory motor nerves in your muscles. So it's either preparing you for movement or it's winding you down and softening your muscles after movement. So if you look at an animal, a pandiculation, if you Google pandiculation, it will also say yawn. So if you look at a little dog or a cat, they yawn as well as pandiculate. And that's because a healthy, happy cat or dog will pandiculate over 40 times a day. That's what the research shows. Whereas a depressed, anxious cat or dog will pandiculate less than 3 times a day. So can you see the link with the emotional side of things and pandiculation?
Yeah, absolutely. And I noticed that when I'm working with my clients, because some of them want or expect a big release, but sometimes it's just a yawn that happens. And I'm like, oh, this is a good sign. Something's shifting. Can I just ask you about the pandiculation with the animals? Because I have this little sausage dog and I always notice when she does this, she's not allowed on the couch. But if we've gone into another room or we've been out of the house and when we come back in, you can hear her jump off the couch and then she sort of does her little stretch and she's got this face about her like, I know I wasn't meant to be on the couch, but I'm just going to stretch and pretend I was doing nothing. What's that about?
I just think you've got a very clever sausage dog that's wrapped you around their little paw. I know. And then when you look at their eyes, you just melt. So they win every time, basically.
It's so funny. Like, yeah, it's like she knows that she's done wrong, but she's trying to hide it.
Yeah, that's exactly what it is, isn't it? So she's just a very clever dog. That's what you've got there.
Back to pandiculation and people.
But yeah, so your little sausage dog, if you look at your sausage dog next time, when she's faking that she's been on the sofa, but she's on the floor or whatever she's doing, to make it look natural. But if you look at her, what you'll see is that she does like a little contraction first. If you watch her next time, she does like a little contraction, then she does her lengthening, and she only goes to the end of her natural movement. So she won't go into a stretch. She goes to where the movement stops before it turns into a stretch. And then she'll settle down. And probably when she settles down, she also gives you that look as if to say, don't have a go at me for being on the sofa. But literally those 3 stages is that when she contracts her muscle, what it does is it lights up her sensory motor portions of the brain, her brain map. When it lights it up, it's like jump starting a little brain, and it's getting her brain to go, oh, so you want me to stimulate these areas of my body? Because every part of your brain map is speaking to different muscles and different regions of your body. So it jump starts her little brain, her very smart little brain that's manipulating you already. So it jump starts her little brain. And then when her brain's on side going, oh, okay, so you've done almost like a jump start to wake me up. Then when she does this very slow, relaxing, yawn-like lengthening phase, which is part of the pandiculation, her brain is absorbing all of this information. It's remembering the muscle memory. It's releasing the chronically contracted tight muscles that could have come from, if we look at other animals in the animal kingdom, like tigers or lions, if they've been chasing their prey or whatever, and they missed it, what they're going to do is when they come to settle down, they reset their muscles. So you'll see them pandiculate. It's part of what they do. But then the third phase, after they've softened and lengthened and reset the muscles, they then just completely go, whoa, and you'll see your sausage dog will go, whoa, and they kind of chill out, and they just like, and they have that moment, and that's called integration. And it's at that point that basically the contraction and the lengthening phase, all that information is flooding into the brain. It's knitting and creating new synaptic or neural connections. And then all that information is being relayed to her beautiful little muscles, so that she can basically run around with her little toy or whatever she wants to do afterwards. But it's a natural thing that happens with the animals. But with us, we do it naturally. You watch children, they do it. But then about 5 years of age, they all go to school, and it kind of gets deconditioned out of them because they're told to sit still, stop wriggling, look straight ahead, all these sorts of things. And unless the child is yawning, or, they might just do the odd little opening and lengthening, they don't pandiculate anymore. So it's something we have to bring back into our life in order to free up those chronically tight muscles. And in a sense, if we've got chronically tight muscles, we increase the sensitization, or that extra pain receptors in our brain, because that's what pain scientists are saying, is that it's the brain becomes sensitized. It's all of the way that we perceive the pain is all up in our brain. So if we know how to embody our movements with pandiculation, if we know how to bring mindset and mindfulness in, like I did with this young chap, what happens is it brought back this empowerment and this education to him, to the point that, like, after that 6-week period that we worked together, and that's what you can see in that before and after photo, when you look at that, he learned pandiculation, he learned mindfulness skills of how to read himself from the inside out, and that's so powerful. He also learned to recognize mindset or belief systems, and if they came into his life, we'd gone through coping skills and strategies to quieten that down and bring in a different type of belief system and a mindset that was actually more on the facts of how he is and how his body works and that sort of thing. And do you know what was really cool about this lad is that with the principles of pandiculation and the process of when one side contracts, the other side relaxes or lengthens, which is what muscle memory is all about. He said to me that he started ice skating, and it was so cool. He'd never done any physical stuff like that before. And do you know what he said? He goes, when I was ice skating, I was thinking of the diagonals that you talk about with the fascia and how they slide and glide, and and getting the spirals back so that there's like a counter rotation with his ribs and his pelvis, all these sorts of things. And that's gold, because when you hear that, you know that they've embodied the practice. It's been a regular behavioral pattern. So what happens is over time, if they keep it going, it will become their new learned behavior. And we know what it's like, a repetition. Repetition starts to become a habit, and then it becomes subconscious. And we want to create new healthy habits and new healthy subconscious behaviors and habits, if that makes sense.
Yeah, and it's so good when they actually go and discover it themselves versus like you telling him to go and ice skate.
That's right. Yeah.
So you're teaching him how to pandiculate.
That's right. Yeah.
Can you give an example? Is that possible? I'm sure people can find stuff on your website, but if people are just listening, can you describe a pandiculation?
Yeah. So, I mean, if you think of just think of a muscle, right? Because there's like patterns. So your brain patterns tension from head to toe. So it's like there are specific pandiculation movements that you would do depending on what it is. But if you can picture this, literally with a pandiculation, what we're wanting to do is shorten the muscle. So we're bringing the two ends of the muscle together. So we're starting to shorten and bulk the muscle. So what you do is, as you shorten it, you start to basically stimulate the sensory and the motor nerves within the muscle. So you start to stimulate it, because with most people, if they're chronically tight, there's not a lot of movement in their muscles. So what we do is we contract the muscle. Now, if someone's in a hell of a lot of pain, the last thing you're going to get them to do is do a massive contraction, because they're already chronically tight. So you'd say to them in that instance, just make the contraction a little bit more than the resting contraction. Because if they go too big, they're going to cramp and spasm a muscle, because there really isn't a lot of range in a very tight muscle. So literally any muscle, you would shorten and contract it. But then the key thing is that you would start to lengthen and release it. And this is the thing, is that as you lengthen and release it, what you start to experience is little shaky, jerky motions. Yeah. And you point to me because have you experienced that yourself?
Yeah. And that's what most people avoid. They avoid the shake. And I'm like, no, move into it.
Yeah.
Yeah. I'm going to get you to talk about this.
Yeah. And that's why, because when you feel that shaky, jerky motion, that is called sensory motor amnesia. So the sensory motor part of your brain has developed a level of amnesia. It's simply forgotten how to contract and how to relax a muscle. So what happens is as they start releasing, when they feel the jerky, shaky movements, this is when all these belief systems of, what's going on? What's going on? And I go, do you know what? Just notice it. Just continue breathing, notice it. And it's shaky, jerky, and then it goes. And then they continue moving. And I go, do you know what that's showing you? That part, that shaky, jerky bit, that sensory motor amnesia, is basically where your brain has been chronically holding that muscle tight. So in your internal GPS, that I'll often say to people, is you have this range of movement you think you can move in, but actually when we move somatically, when we use pandiculation, when we work mindfully, when we trust the process, we trust our body, everybody's in charge of their movement when they're pandiculating. No one's forcing them to do anything. When they have all that belief system behind them, they can just become curious. And I always say, be curious, because the neuroscience again shows that when you're curious, you use more of your frontal lobe, less of your stress centers. And when you use more of your frontal lobe, this is where we start learning. You think of children are always asking why this and why that, because they're curious. That's how we're like a sponge, we absorb things. So when we see the shaky, jerky bit, we don't overanalyze, why is this the case? We just go, that's interesting. Let me continue exploring, where will this end of natural range be before it turns into a stretch? And then what happens is you go, and you just let everything rest. And as I mentioned before, that integration. If you're a person that's lived on high functioning anxiety, felt that you've got to fit a million things in your day to be productive, the integration or the pause is a challenge in itself. And again, it's a belief system we need to deal with, because the pause or the integration is incredibly powerful, and it's giving your nervous system permission just to rest. So we do that, and then we repeat that process. So we contract and we lengthen and release and integrate and repeat it. And each time we notice that jerky, shaky movement gets smoother over the time.
Yeah.
Because we're becoming more conscious, and the muscle is starting to learn the memory again. It's starting to bring the proper sensory motor behavior back to the muscle. That's something you don't get when you stretch. Because when you stretch, there is no involvement of the sensory motor cortex. So there's no re-educational learning. And that's what's so powerful about pandiculation.
Oh, that is a really good explanation. There's a couple of things that I remember getting my clients to do when I was working hands-on, and sometimes I still do it in the online space, but my sort of two testing areas were the shoulders, of just like a simple shrug and then really lowering it down, and you can just see how shaky it would be or how one side would be worse. And then the clam in the hips, like the side lying and lifting the knee. And so many people would be like, oh, my hip's stopping. And it's like, no, once you get the control, I don't know if that's the right word to use though, but once your brain starts speaking to those muscles and you get that contraction and relaxation phase under control, then you'll find you'll be able to go further. So it's not about strengthening or stretching. It's about, integrating.
And that's brilliant. I don't know if you've tried this, Jing, but give it a go. When you get somebody to shrug your shoulders again, and anyone listening to this, have a go with this now. If you shrug your shoulders, okay, and then just slowly release, let them release. Okay, now when you feel you're there, stop there, take a big breath in, and with your out breath, just notice what else can you fully let go in your shoulders. Can you let them go a little bit more? Do you notice that?
Yeah.
So when you get to the end of where you think you are, that's where your subconscious has kind of created the baseline. But then when you become mindful and you go, hang on, is there any more I can let go of? You'll notice that you can go a smidgen more. There's a little bit more. But if you're talking about shoulders, I love doing the shoulders. And again, you might want to play with this. And if anyone's listening and they might want to play with this, I kind of talk about the shoulders thinking of a compass. So think of north, east, south, west. What you can get somebody to do is do one shoulder at a time. And they could shrug their shoulder towards their ear, and then incredibly slowly, and just breathe naturally here. Just let that shoulder lower. So really let it release and lower. And then when you get to the end, again, take that deep breath in. As you exhale, go, what else can I let go of? Some people tap their shoulder. Then what you want to do is draw your armpit towards your hip. Now you do it gently. Don't overdo it, because you don't want to pull on your neck and create discomfort. But you literally draw your shoulder down towards your hip, your armpit towards your hip, and then slowly release. So what we're teaching here is that as we contract the muscles through the side of your body, your shoulder, or like your traps, for instance, the shoulder muscle can learn to let go and release. So you could slide up and down, north and south, but then you could roll your shoulder forward and then you could slide back. And with this one, this is a cool one, because this is when you feel the shakes and the jerks. And so what you want to do is go really, really slow and ask yourself, this is that curiosity, and think, which way feels easier for me? Is it rolling my shoulder forward? And think about this. When you roll your shoulder forward, your chest muscles are getting tight. The muscles at the back of your body are lengthening. So here's that principle. This is pandiculation. This is bringing muscle memory back. But then we want to switch that. If you slide your shoulder blade back, Slide the shoulder back. Can you feel your shoulder gliding over your rib cage? Can you now feel that we're opening through your chest and tightening through the back of your shoulder? And then what you do is just keep going back and forth. And as you do this, what it's starting to do is bring greater range of movement, flexibility into this area through your nervous system, through your muscles. And so what we think of is we go east and west, let's say that, or forward and back, we do that. And then when you've done a few like that, then I'd encourage you to shrug your shoulder up towards your ear, then slide your shoulder down and back, and then draw your armpit down towards your hip, and then roll your shoulder forward and make it really small. Keep breathing naturally, but notice which part of that shoulder circle feels easier. Notice where the shaky, jerky parts are, because there will be little shaky, jerky parts there as well. Little things like notice if you're holding your breath. Is there a certain part of that shoulder circle you are? And also, what is the shoulder circle feeling like? Is it a circle, or does it feel like there's jagged, chunky bits missing out of it? Or do you feel you're cutting across the center? Now, if you do that, you could do it sitting, but I also encourage people to do it like lying on their side. And so they could, have their legs at 90 degrees, have a head under their, a cushion under their head, should I say. I get them doing this and going one way and then going the other way. Then I encourage them to lie on their back. And when they lie on their back and they compare the contact points of that shoulder they've just pandiculated to the one they haven't done yet, what you see is doing those little movements, you've already started to release a lot of tension in your shoulders, and your shoulders making more contact points and closer to the floor. It's really powerful. But if people just do that alone, think of all the muscles that it's going to release through the front, the back, the sides, the neck. It's going to free up all that jamming that can happen in that beautiful ball and socket joint. And also it's just a time out, instead of sitting there carrying on with a bit of work. Maybe they can take a couple of minutes out and pandiculate each shoulder individually and then bring them together. And I would suggest doing one individually, because what you find is one side's much more dominant. And when it's dominant, it will try and get the other side involved. So you want to really get your brain to focus on one side at a time and then integrate it and bring it all together. It's pretty cool. And I mean, now I've been demonstrating on my right shoulder, I can feel the difference between my right and my left. So after this, I'll do the other side.
Yeah, I'll do the other side as well. That's great. I hope people were able to follow along with that. So when the physical body changes, how do you talk about the emotional state and the belief systems shifting as well?
So I get people to realize that basically our emotions, everything about us, what brings us to today, because everyone's got their own story and it's molded them to the unique soma that they are, that unique individual. Basically, what was the question again? Because I was just thinking of about three different things there.
That's okay. And I'm here doing my right shoulder.
I'm watching you move your shoulder thinking, is she doing a full circle? So there's like three things in my head, watching you roll your shoulder.
Sorry, I won't distract you.
That's all right.
So because it's when this physical body starts to change, and likewise when emotional state starts to change, how do you describe this integration? Like when the body stops shaking so much and the movement is smoother or the range of motion is greater, how does that tie into their emotional state and their belief systems?
Okay, yeah. So in the brain, we've got an area called the brain stem. So it sits right at the bottom at the back there, and it's involved with all subconscious actions and behaviors. So like your heart rate is involved, is told to beat there. We don't have to think about that. Breathing, hormonal secretions, digestive functions. It's all the stuff that keeps us alive. It keeps us going. But also in your brainstem, you have survival stress postures. And this is what's so incredible, is that they are there to protect us and to make us survive. So if people can picture this as well, if we go back to the cave person era, so that person's walking along and then all of a sudden like a saber-toothed tiger comes out straight away there and then, that's like there's a stress response that's going to be induced. Immediately there's a brainstem postural reflex that will happen. So what will happen is either that person will hunker down. So I mentioned about that young lad before, shoulders roll forward, the ribs depressed, tailbone tucks up and under. But because you always want to know what's happening, your chin juts towards the horizon. So you're looking straight ahead at what's happening. So you see people walking around like that now, don't you? Now, that back then and still today in our brainstem is a stress survival posture. Another one that we see, again, this can be from like high functioning anxiety, people that just want to stay incredibly busy all the time, push their emotions down, thinking if they push them down and they don't think about it, it will go away. But we know it doesn't, And so what happens is when you look at the postures there, their bottom sticks out. They've got quite a sway back, got a very straight back, their shoulders pin back, their chin draws in. So they're almost like a sergeant major. And those sorts of people, you hear them before you see them because they are pounding through their heels. So they're full on, and basically there, all the tension and contraction is through the back of their body. Whereas the other person, it's all through the front of their body. So when people come in now clinically, what we're working with is the emotional triggers that have basically stuck them in those postural patterns. And with pandiculation, we use it to wake up your brain to stop it living in this cycle of anxiety and stress.
So to complete the pandiculation.
Absolutely.
That's what you were saying, like humans, they get stuck in the contraction phase and they don't get into the stretch, although it's not a stretch.
You got it. Because if you look at like the animal kingdom, look at documentaries, you see the animals chasing, and then when they finish, they pandiculate, and it's a reset. Not only do they do that, and this is what I teach, like when there's a lot of people I'm working with trauma therapy, for instance, is that what they do is the animals will yawn or they'll go, wah, like this. They make this noise because it's audible and it's a vibration and it's releasing the tension within their neck and this whole area. Or humans, think about what happens when there's been trauma. People lose their voice. Their voice can be very quiet. They can get a lot of tension around their neck, all sorts of things. So when we're looking at pandiculation, I'm looking at, and once people learn clinical somatics and some total somatic movement, what they start seeing is when you look around at people, you can read their nervous system. You can see what stress pattern they're in. And we can't get rid of those stress postures. We need them. If you're about to step out into the road and a car comes racing around the corner, that brainstem response is going to kick in and it's going to pull you back and take you back. So we need them. But I always say to people, we want resilience in our nervous system. So we want to be able to spring into them, but we want to know how to get back to a state of balance or homeostasis. So when we have that resilience, that also helps us to work with our emotional mindset as well. Because sometimes, as I've mentioned before, you can teach people pandiculation, but if it's all they're reliving things in their head, you can teach them the best pandiculations in the world, but unless we change the story and the dialogue and the narrative in their head, it will continue to project on their soma, and you see it in the patterns of tension. So that's where it really does change. And again, I will get people doing eye movement. So we do eye movement pandiculations, because if you think of people when they're anxious and they're terrified, their eye muscles will go rigid as well. There's one of two things. They'll either be locked solid, looking straight ahead, or you've got the other people that their eyes are darting around all the time, looking for an escape route. It's that sort of thing. What we need to do is even quieten down the eye muscles, because what we know is that the tension in your eyes are linking to your jaw and to your neck. So it's all, again, it all comes back together. It's pretty cool.
Yeah, I like how you use the animal example. I use that quite a bit in terms of, like, yes, they do the movement, they shake, they might make a sound, they might pee, poo, vomit, and they just let it out and then they go on their way. That's but right. As humans, we don't get there. Do you know of Stanley Kelman's Emotional Anatomy book? Yeah. Yeah, that's an old book, but it's got some great diagrams, and I usually present that to my practitioners. I'm like, well, just look at the person. That's right. And can you start to see people like this out and about in your world? And what is the energy that you pick up when you just see someone who's got their back arched, or like they're ready to fight, or they're hunched over? I think we can all relate to the depressed person with those hunched shoulders, but there's so many other postures. That's if we just allowed ourselves to understand them.
It is, and it's that body armoring, because that's what you're referring to, isn't it? It's that body armoring. And if you think about it as well, is that if your body or your muscles are being told by your brain to stay tight all the time, you can see why people get so exhausted. They've got hardly any energy. They lose their motivation for things. The pain, the joint health, everything starts to flare up because it's hard work. If I walk around just flexing it's a very pathetic looking bicep, but if I was to walk around flexing that all day, that's hard work. And then you think, that would fatigue quite quickly. And then think of all the other muscles that would have to recruit to try and make it happen. Think of my joints. Think of it's just using unnecessary energy. Yeah. So what we want to look at is how can we work intelligently with our very, very smart soma, very intelligent soma with this process of bio and neuroplasticity. How can we work to get ourselves to work and feel and move more efficiently throughout our day? Because I think that's all what we want, and that's why in total somatics, I say reduce pain, improve posture, increase mobility, enhance your mindfulness skills. Now, I say that, but there's so much more underneath it. But, if we knew how to do that, it's going to make everything we do in our life, the hobbies that we want to pursue, picking up grandchildren, and having the energy to do that instead of feeling like we're getting old. Yeah. And Thomas Hanna, who created the modality somatics many years ago, he actually said this old man stoop, he referred to it as the myth of aging. He said, when you see these people stooping, people say it's to do with aging, but he said it's to do with habituation, do something over and over again, or adaptation. So you adapt and shift and change. And he's right. If he was alive today, he'd see his words are so true, because you've got young teenagers now that habitually are on devices, which makes them stoop. So they might be 13 or 14 years of age, and we wouldn't say they're an old man or an old woman or whatever. But what you'd say is, you can see how their habits are molding and changing the posture that they have today. And this is why this work's so powerful, because the younger generations that are coming through, they need to learn these skills of pandiculation, because you've worked in that clinical role and you know what it's like with the muscles and the joints. If we've got young people in these old postures now, what are they going to be like in 30 years' time? Yeah. This is a really serious thing that we kind of need to look at now. Technology is wonderful. We're able to communicate like this, but we also need to have that adaptability and that resilience to support people as the years go on.
So is it a set protocol of movements?
So there are different ones. So there's like a protocol for, remember the one that hunkers down. So like that one that's like a fetal position. So we would use a protocol, because what we want to do is work with how the brain patterns that tension. So there's a specific way that way. If you've got somebody that's got that go, that high functioning anxiety, there's a protocol that we would use there. There's also another protocol for people that have got tension through one side of their body, which may contribute towards like scoliosis, for instance, that sort of thing. So clinically, you would work with those protocols initially, and you would teach them movements with those protocols as well, so that we can start getting your brain learning that there is a range of movement and they don't have to be stuck in that one movement posture. But then as they start developing their practice, this is where then, as a clinical somatic educator or a somatic movement teacher, you would then create movements to work elsewhere. So the reason I say that for is in somatics, we always use the principle work from the center. So work from the belly. And because you think of the brainstem response, it's going to tuck your tailbone up and under, or it's going to stick your bum out. And it's also going to impact your ribs. So we work from your center. And then once we've got that under our conscious control, and that's what we do with those three protocols, then we would do additional pandiculations to start freeing up the periphery or the limbs and elsewhere. So we start from the center, get that back under our conscious control, create that resilience in the nervous system, and then we can flow with other movements as well. So there is a set protocol, but then after you've gone through that protocol, that's where you would address it specific to the individual.
Oh, great.
Yeah.
So how is it that people come to find you? Because not that many people outside of the health world would really understand the word somatics.
Yeah.
So is it the desperate, the people that everyone else can't work with, that come to you? Like osteo, we used to be very much last resort. I'm very much last resort for people, which is a shame. And I think, we're on similar missions for people to not be acting and reacting in that way. But how is it that people come to see you?
So a lot of it is, so I get a lot of referrals from like clinical psychologists, from chiropractors, from osteopaths, from massage therapists. And I teach around Australia. So I teach somatics to different health practitioners. So what I find is that is actually starting to increase awareness. And when the world opens up again, I used to fly and do a lot of teaching in the UK, but now that's why I do a lot of it online. So I've got the membership, and I do periodically throughout the year, I always do live online events, and they're free, so people can join. So they can always go to totalsomatics.com if they want to learn more with that. But I am like you, that you do find that they've been through the system. They have been through the system, and it's kind of, if, for instance, with somatics, it's now becoming it's becoming the new word. Like a few years ago, it was mindfulness, and mindfulness was tagged onto everything. Now, somatics appears to be the word that everyone's hashtagging, and they're just tagging onto anything. So it's where really, when people start to delve into it, what they want to do is really do check if it is somatics, and it's not just someone that's tagging that on, because what we want to do is we want to be able to work mindfully and carefully. And I don't know if you've encountered this, but you will find that people will jump on things if they think it's the latest thing, but the proof is in the pudding. At the end of the day, what we want people to do is to embody themselves, to feel those changes, and to know they're working with somebody that's a certified practitioner. So that's the most important part as well. But yeah, you do find that they come in from all areas. But I'm finding now that somatics is really starting to increase in awareness, thankfully. It's taken years and years and years, but my membership's the only membership at the moment out there in the world that's teaching people. So people do online classes and things, but with my membership, there's a lot more to support people. So if people are interested, what they will find is that there is like a structured path within the membership. And then there's additional little programs and modules. And I have experts within the membership from all around the world. And they're bringing in a somatic awareness from their part of their modalities in their area of health and well-being. But it's to broaden members' horizons, to broaden their belief systems and their thoughts, because I want people to continue to question things. When they stop questioning and they take everything that you say at face value, that's when you realize that we're turning it back into that authoritarian mindset. And I want people to be stimulating their brain, questioning. When I know they're doing that, I know they're doing their practice and they're listening. And also, I'm also noticing a belief system. If there's something that keeps cropping up, maybe that's something within the membership that we deal with. And that's what I find the members around the world are so supportive of each other anyway. So it's there. If people are interested, it's totalsomatics.com.
Amazing. And on Instagram, is that where you post other stuff?
Yeah, and on Facebook. So Facebook, it's Total Somatics, and then on Instagram, it's total.somatics. So they can find me there. And there's a lot, if they go to the website, totalsomatics.com, and somatics is SOMATICS. Sometimes I think my accent's a bit, I never know if people can catch what I'm saying. But yeah, with totalsomatics.com, if they go on there, they'll see there's like free books. There's lots of free things. But I also have a podcast as well. So every week I release an episode, and that can be found on all platforms, Spotify, Apple, all that jazz, and it's called Somatic Movement and Mindset. So I talk about neuroscience, pain science, and then at different times I bring in experts from around the world that will talk, and they're ones that have put things within the membership as well. So it's pretty cool.
Brilliant. Thanks so much for sharing all of your information today. It's really fascinating.
That's all right. Thank you.
Thanks for learning with me on the Art of Listening to Your Body podcast. If you like what you've heard, I would love if you could rate, review, and share with your friends. You can find me on Facebook and Instagram. My handle is The Art of Listening to Your Body. If you're interested in working with me, I offer online courses for the general public and trainings for practitioners, therapists, and coaches. I also open limited one-to-one coaching spaces throughout the year. If you would like to find out more, head to my website, drjinong.com.